How much do we blame our genes on who we are and how we are as a body? Well, I think quite a lot. So, today, my topic of discussion with you is how much genetics impact our teeth health. For those who don't know me, my name is Swati Maan. I'm a dentist, and let's see what's the correlation between genetics and our teeth. So the first thing, if we talk about here, is the dental decay, which means the dental caries. And we all know that the major responsible factor for the development of the caries is the plaque. And the studies have proven that the plaque microbiome or the bioflora or the bacterial structure of the plaque is quite to a large extent is hereditary. That means that runs in the family. But the cariogenic bacteria, which means the bacteria that creates the cavities, are environmental. That means the environment gives rise to the cariogenic bacteria, which are responsible for causing the cavities. So, of course, it's true that the genetical makeup does play a role, but majorly it's the environment that we provide by eating carb-rich food, not keeping our teeth clean, or not following the right regime for oral cleaning is the main factor which is responsible for causing cavities. Another thing I would say here that hereditary also plays a role in terms of the habits that we pass from generation to generation. Some families they love sweets or they love munching or they enjoy those kind of carb-rich diet, and the habits of maintaining oral hygiene is also passed on from generation to generation. So in some families, the flossing is not something which is a regular habit. So in some families, regularly visiting the dentist every 6 months is not something that they follow as a routine thing. So it's not just the genetics that play a role. Well, of course, that's one of the factors, but the major factor that plays a role is the habit or the environment that we get surrounding the genetics. Similarly, if we talk about the periodontal health, it is affected by the genetics in the way of subgingival microbiome, which is the microbioflora or the bacteria present underneath the gum surface or under the gum, plus the environment that we provide to these bad bacteria to grow. If we specifically talk about the gum problem, this is a two-factor procedure. Number one is the genetical susceptibility, which means what kind of body type we are, which is responsible for getting this periodontal gum problem, and that genetical susceptibility is approximately 30 to 50%, plus the environment that we provide to the bad bacteria to grow, the behavior, which are the habits of an individual, for example, smoking, vaping, alcohol, or number three, the systemic problems, which means the diabetes, any heart problems, any infections, etc., which can lead to the gum problems as well. So it's not just the genetical makeup of the person, but also an epigenetical factor or the multifactorial factor which is responsible for giving rise to the gum diseases. But there are a few factors which are quite highly defined or determined by the genetics. Number one, your chances of having braces, because your size of the jaw or the shape of your jaw or the alignment or the shape of your teeth, bigger or smaller, is genetical, and that can run in the families as well. So if your parents, grandparents had crowded teeth or they needed braces, there is a chance for the child as well to have braces. Another few things are anodontia or hypodontia, which is extremely rare, but that means missing teeth or complete absence of teeth. Amelogenesis imperfecta, that means there's a defect of the development of enamel. Dentinogenesis imperfecta, where the second layer of your tooth, which is a dentine, is missing. Cleft lip and palate, which means there's a cleft in the lip or palate or both, is also a developmental issue. So there are a few things which are determined by the genetical makeup, but the major health of your mouth, which means in the form of decay or periodontal health or the gum health, is quite environmental as well. That means there's a lot what we can do, and there's a lot what is in our control as well. So yeah, this was some information about how genetics control our oral health, our oral environment. If you have any questions, please feel free to drop me the message in the comment section, and I will look forward to meet you all in my next video with some more information about your teeth and dentistry. Thank you all for watching.